Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix, Arizona. Today I'm at SkySong, which is a development in southern Scottsdale. It's the Arizona State University Technology Center. It's fascinating to read about it. It started in 2009 is when they completed the first phase 1 and 2 of the project. And it's amazing. Companies started coming here in droves that wanted to be affiliated with ASU. ASU is a hotbed for technology. And a lot of the professors and the engineering department is top-notch. So they're able to affiliate with them and utilize all those resources. So within 2 years, well, 2009 to 2011, they now have 75 companies here, and they're at 85% capacity. They're bringing in $100 million to the annual economy of Scottsdale. 30% of those companies are international. And they range from technology to consulting to, there's a Quest, in here. There's students who get venture funding to start up companies such as these students have 3D glasses for the movie industry. There's some venture capital companies here as well, the Arizona Angels Network. Anyway, the topic for today is anesthesia. What are the anesthesia options when you have pain management procedures? You know, patients want to know, well, do I have to get an IV and medication that way? Others are very claustrophobic or nervous and they want to get those medications. So the question is, what are my options? Well, most patients who have a simple epidural injection or a facet block, which is an injection into the lower area of the spine, those little joints, they don't need full-fledged IV sedation and big time, getting knocked out. They don't want to have limitations with driving home or have to bring a ride that waits for them. That's usually not necessary. So that option is available. You could take a Valium maybe a couple hours or an hour ahead of time by mouth, and then have the procedure with just numbing medicine injected into the skin and around the area of the injection. And then once it wears off, within an hour or 3 hours after the procedure, patients are able to, go back to work or drive home, as long as they're safe and pass the tests that the nurses give. The options for anesthesia, though, you can have an IV placed and end up getting Versed or a little bit of propofol or one of these short-acting amnestic agents that help to sedate the patient, help make them not remember the injection, and help it make it much more tolerable. So those options are available as well. The bigger ticket options such as general anesthesia or an LMA, which is close to general anesthesia, pain management really doesn't do those. I mean, if you're going to have a spinal cord stimulator placed, that falls a final implant placed, yeah, you may end up getting an LMA or general anesthesia, but that's usually not performed in an outpatient office. It can be. In a regular surgery center, yeah, that may be what you end up getting, but we're only talking about maybe 10% or so of patients who need that. Okay, most by and large, it's either by mouth with little numbing medicine, maybe an IV where you get just a tiny bit of sedation to make it more relaxing. But it's unusual that you would need full-fledged being knocked out with the tube being placed down, to the windpipe and whatnot. So that's an overview on the anesthesia for pain management. I'm Dr. David Greene. Check out our website, preferredpaincenter.com. I run the blog of pain. We have a lot of educational videos and animations about all kinds of pain management conditions. Call us today at 602-507-6550. We take major medical, personal injury, liens, as well as self-pay. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.